Did you know that disappointment in love can cause a heart attack? A disappointment in love can cause a heart attack even in 100% healthy people. This phenomenon is known as Takotsubo syndrome, or popularly broken heart syndrome, and occurs due to a temporary dysfunction in the heart and is often triggered by situations of great physical or emotional stress. A heart attack, a disease that, according to the Ministry of Health, kills more than 60,000 Brazilians per year, is caused by the obstruction of arteries, which are a type of vein responsible for transporting blood to the heart. The blockage usually occurs due to the accumulation of fatty plaques on the walls of these arteries. In addition to the biological factor, a sedentary lifestyle, obesity, smoking, and genetic components influence cases. However, even without these characteristics, that is, without a genetic factor, not being a smoker, not being diabetic, or even without any other risk factor, a person can have a heart attack due to great emotional trauma. This can occur in people who have experienced extreme events, such as earthquakes, tidal waves, tsunamis, and even a major heartbreak. In 2017, Veja São Paulo magazine reported on the case of an American woman who was 62 at the time and developed broken heart syndrome after losing a pet. The woman complained of chest pains after the animal died. After performing an echocardiogram, a type of ultrasound examination of the heart, doctors diagnosed the syndrome. Symptoms of a heart attack. According to the cardiologist, the main symptom of a heart attack, a disease also known as a heart attack, is severe pain in the central region of the chest, which may be accompanied by shortness of breath, difficulty breathing, a feeling of fatigue, and cold sweat. Even though these symptoms are more common, it is worth noting that this is a type of silent heart attack. There are people who can have a heart attack without feeling it, just feeling unwell, popularly feeling a pain in the pit of the stomach, especially diabetic patients and women. People in these groups can have a heart attack without necessarily having chest pain. These are situations that place the person facing very shocking events, such as a strong romantic trauma or a major family problem, such as the death of a very close or dear relative, which can trigger a heart attack, and, in the face of any abnormality in the heart or chest region, the best thing to do is always go to the emergency room. The best thing to do is to seek immediate medical care. In these cases, you should not go to a doctor's office, whether a public or private clinic. In these cases, you should go to an emergency room, an urgent care unit, or a hospital where there is emergency care and you can receive good treatment and guidance. Emotional heart attack, also known as emotional heart attack or broken heart syndrome, technical name Takotsubo cardiomyopathy, occurs when a strong emotion, such as deep sadness, anger, fear, or shock, causes a temporary change in the heart muscle. This condition can mimic a traditional heart attack, with symptoms such as chest pain, shortness of breath, sweating, and feeling faint. How can emotional stress affect the heart? Sudden increase in stress hormones. Intense emotions release adrenaline and other hormones that can overwork the heart. Changes in blood circulation. Stress can cause arteries to constrict, reducing blood flow to the heart. Temporary damage to the heart muscle. In Takotsubo syndrome, the heart muscle fills with blood and becomes temporarily weak, leading to symptoms similar to a heart attack. How can you prevent and deal with an emotional heart attack? Managing stress. Relaxation techniques, meditation, exercise, and hobbies can help reduce the emotional impact. Seeking emotional support. Talking to friends, family, or mental health professionals can help you deal with intense emotions. Maintaining healthy habits, eating a balanced diet, getting quality sleep, and avoiding excessive alcohol or drug use also contribute to heart health. Recognizing warning signs, chest pain, shortness of breath, palpitations, or feeling faint should be taken seriously. Seek medical attention immediately if these symptoms occur. Important: if you or someone you know is experiencing strong emotions or showing symptoms of heart problems, it is essential to seek medical help as soon as possible. A professional can make the appropriate assessment and guide the necessary treatment. Take good care of yourself and remember that emotional balance is an important part of heart health.